Okay, good morning everyone and welcome to today's webinar. We're very pleased to welcome Tony Bough and Katharine Metters, who will be delivering this session today. Before I hand you over to them, I just wanted to mention a few things. So firstly, for those of you who haven't attended one of our IOSH webinars, I am Ben Pollard and I take care of the technical aspects of these sessions. So if you have any problems, I shall try to assist as best as I can. On your screen then, most likely located at the top left-hand side, you will notice a small bar with some written options on them, which are chat and Q&A. If you have any technical issues or audio problems and need to message me at any point, please use the chat option. If you have any specific questions for Tony or Katharine relating to the content of the session, then please use the Q&A option and ask your questions here. You can open and minimize these boxes at your own leisure. Should a message be sent out to you, it will flash orange. So with all that said, I shall now hand you over to Tony and Katharine and hope you all enjoy the session.
Hello everybody, I'm Tony Bough, I'm the chair of the Financial Services Group. We're going to be doing a session on ergonomics and a session on mental health today. So Katharine's going to be covering ergonomics and I'm going to be covering mental health. Before we start, I would like to do a very brief introduction to the Financial Services Group, IOSH's newest and I would say best group. Being the chair, I am of course very biased. I've put here for you all the kind of people we're trying to cover in this group. If you're actually interested in joining, you can contact membership and they can switch your membership from whichever group you're in over to the Financial Services Group. Obviously, as with any webinar that IOSH do, we're not just closed to those people that are in that group, but it would be nice to get some members that are interested in doing any networking, that are interested in making suggestions for this kind of webinar, etc. So that we can deliver these kind of webinars in the future, because obviously that's certainly one of the main things on our agenda. We are also launching a networking event on the 7th of September that's going to be in Zurich's offices in London. It's invite only, so if you would like to attend, if you drop me an email, my email address is on there. Please don't send me any requests or sales kind of things. I have put that there in good faith. But if you do have any suggestions for any webinar that you would like to see in the future, if you want to do any networking, etc., obviously that is my email address. So I'm not going to beat you over the head with this group. We do have a microsite, so you can on the IOSH website, so you can check us out if you would like. I will therefore quieten myself for a while and I will pass you over to Katharine. I'll let her introduce herself. She can do that infinitely better than I can.
Thank you, Tony. Right, well, I'm Katharine Metters, and for those of you that don't know me, I probably ought to have a bit of a health warning here. I'm going to be talking about ergonomics for agile workers. My background is as a physiotherapist. I'm a chartered physiotherapist. I then into ergonomics and also into health and safety. So I'm very much coming at this from a musculoskeletal side. So please bear with me. I actually believe that agile working is a huge opportunity for us to be able to improve things for our staff. I was at a conference yesterday and we were talking about how we need to get people moving more. And what was really important is a culture shift. And actually, I think agile working could be this opportunity to create a culture shift. So as I say, I do have a passion for this, so bear with me. So what I'm going to cover this morning briefly is on your screen now. So looking at the pros and cons, what we need to consider when planning, risk assessment, and some specifics about ergonomics and key body messages, really just to make agile working work. So starting at the beginning, what are the drawbacks and benefits of agile working? Well, funnily enough, at the top of that list on benefits, we've got increased movement. We all need to start moving more. We've become all very sedentary, and it's not good for us, not only from a physical point of view, but from other aspects as well. There's potential for a better use of space, providing flexibility for staff, also flexibility for our businesses, giving people the right tools for the job, which I think is absolutely vital and something that is a real opportunity with agile working. I am a bit of a Luddite myself, however, even I recognise the advantages that IT development has provided for us, being able to work in different situations and in different ways. Reduce travel, particularly actually in peak times, is an option with Agile, with a lot of Agile working, so that's great. And actually handing some control back to the employee over how they work, I think, is vital to improvements. So those are all the benefits, but if we head on into this without a deal of planning and thought, we could land up with some of these problems on the right-hand side of your screen. Instead of actually the benefits of increased movement, we could land up with a series of very poor postures. And in fact, if you perhaps look around now where you're working, maybe you are in a cafe, have a look around and see what poor postures you can see in your colleagues. Communication difficulties, I'm afraid, can be rife. The creep in longer working hours, I think, is particularly noticeable for home workers. It is difficult to control, difficult to supervise people if you can't see them. And as I say, being not very good at IT myself, I find IT issues sometimes gets in the way of working well. We also may have more people working alone, and we're going to need a different set of management skills. And if we don't develop those, we could land up with significant problems managing our staff. And at the end there, I suppose that fits in very much with lone worker, is the problems that we may be associated with isolation. We're trying to improve collaboration, but we could actually be going in the opposite direction. So what do we do to try and plan to avoid this? Well, my advice would be is we need to consider things as a series of tasks. We need to consider what tasks are needed to do the job and then plan looking at this series of activities. If we do this, we are likely to get a better outcome, not only for the individual, but also for the work itself. And once we've thought about that in a series of tasks, this will be able to guide us as to what equipment we need to give people, what sort of spaces we need to provide them with, where these locations need to be, and the different ways that we have to facilitate communication. And once we have that in place, we are in a good position to then decide what advice we need to provide and what controls we need to put in place to ensure the safety, productivity and health of our staff. So for me, it's all in the planning. And that leads us clearly on into a risk assessment, which for me is one of the best planning tools. Once we've actually thought about the role, what the role requires, we're now in a good position to look at this risk assessment. And for me, for Agile workers, from the ergonomics point of view, we need to really look at these particular issues, mobile and hot desking, lone working, manual handling, the issues around travel and driving, as well as work pressures and working hours. Now, due to the sort of length of time we've got to talk and the areas of expertise, I'm obviously going to be focusing my time on DSE and the physical requirements of using IT in an agile way. I know Tony's going to be talking a lot more about some of the other issues on this slide. So what questions do we ask when using DSE? Does our agile worker, where is their workstation going to be? Is it just one workstation in an office? Are they going to be using hot desking? Are they going to be using public spaces? Are they going to be at home at all? And if so, how much of time are they going to spend at home? And are they going to have to be working on the hop, working in and on transport, which certainly I need to do and a lot of my colleagues need to do. And that will then sort of imply what they need to do with that. Do they have to carry their IT with them? That would obviously bring manual handling issues. It also might decide what type of equipment. Does it need to be portable or foldable? So then we think, well, actually, if they're using clients' equipment, that might be a really good thing. Your clients may have some great hot desking environments. But actually, from talking to people, people will say, well, often they don't, or they don't offer them to us. Well, surely that's something we should be putting in their contract. If we are going to do some work for a client, we should ask to use the equipment. And certainly in my experience, if you ask in advance, you get that support. But often we just don't ask the question. Are we going to be using our own equipment on client sites? Do you appear at somebody's site and then find that for security reasons you can't use your equipment? These things all can be dealt with in the planning. And do we use third-party equipment in airports? We see now, these terminals springing up that we can use. Do we consider the security? Do we actually consider the physical flexibility of these areas for our staff? And then finally, how long do we use each of these workstations for? Absolutely key for me is the duration of the activity. And I don't think we spend enough time thinking about that. So just a little note about DSE regulations. It's something I get asked an awful lot. Do I think the DSE regulations are still valid? Well, I think the essence, the fundamentals of the DSE regulations hold. But agile working has brought so many different situations to us. So I think we need to go back to why do we have the regulations? What were the aims of them? And go back to the basics and apply it to ensure people's health and ensure their productivity. Yes, the checklist in the back of the regs probably isn't fit for most of us, but actually we're not doing this for audit purposes. We're doing it to ensure people's health and their productivity. So let's keep focused on that. I think, as I said at the beginning, that the agile working provides great opportunities to manage our DSE risks better, because so often it's all to do with movement and time allocation. So I think we should really grab hold of that. And for me, the key is to get people to choose the right tool and workstation for the task. So I now just want to go through a few of the little agile working scenarios. So hot desking, I think it's something a lot of us, if not all of us, use these days. And so often it's poorly designed. One size does not fit all. If we don't provide flexible workstations, we land up with the person using it having to adapt. Humans are great at adapting, but the trouble is if you adapt for too long, that leads to strain. If you need to look down to do something, yes, you can do that, but you land up looking down all day, you land up with a poor neck. And if you do that for long enough, you land up with a neck condition. So let's think about these things. And if you make environments rubbish, people won't want to use them, and then we'll complain that people aren't being collaborative. So we need to make sure that we have proper adjustment. That often hasn't been the case. A lot of the time we provide either seated or standing workstations. Well, that may or may not be appropriate according to the work that's done. They're often poorly maintained. Where do you find all the broken chairs? In the hot desking area. So we need to make sure that's the case. Uninviting areas, we're not going to get people in. And actually something we're getting a lot of is poor acoustics. You know, why would you want to work in an area where you can't, you know, work for not being able to think? So do consider the acoustics. And obviously on the right hand side is the opposite of that. What should we be doing? We should be making flexible equipment that will accommodate people. And actually, if you make it flexible, you're going to be able to accommodate more people, and you may find out you need to provide less specialist equipment. So there may be a saving there, because if you're creating more flexibility, you can accommodate more. So range of workstations to make sure that that fits with the tasks. You may need collaborative areas, you may need remote communication areas, you may need actually quiet areas for secure and private conversations. Make things attractive. Make sure that people are encouraged to take breaks, as I say, and make it a desirable place to be, and then you'll get people coming in and using it. What about on the move? A lot of us do it, have a laptop or a Surface or a tablet. Unfortunately, when you're using small devices where you're looking at the same place that you're putting your hands, you're either going to land up with heads down or hands up. Both are going to create problems. And that is the problem with it. We also land up with lighting issues, and we also land up with the fact that this thing being mobile, we can use it anytime, any place, and we think for any task, but that's where the problem comes in. We need to use the right tool for the job. Make sure we use the correct tasks on the correct devices. If you are typing up a report, you should be using a properly designed workstation. If you're scanning emails or listening into something, then maybe a small mobile device is appropriate. Looking to provide Bluetooth keyboards and mice can be very effective to improve the situation for mobile devices. Consider different input options. Why type when you can talk? certainly an option for me, but there again, I talk quite a lot. But it really, for me, is quite liberating. I can't type and I can't spell, but actually I can use a piece of kit sitting back in my chair with a nice headset. So often a good option. Maybe if you do require people to hold on to their devices, providing handles or straps would reduce the tension. So think about that too. But don't forget movement. If you're working in a poor position, move regularly and you'll mitigate some of the problems. The ergonomics on transport is very similar, obviously, to mobile DSE, but we do see a lot of it. However, in transport, you often see far more restricted positions. So we land up with a lot of awkward arm and hand positions. And we do land up with a lot of tension to navigate, because with the device moving around, actually trying to navigate around it becomes a far more tense activity. So again, let's advise people to think about what tasks are suitable when. When you are traveling, surely this is a time to actually think. I know we don't do enough of that, but thinking and reading, it's for time for short notes, not typing long emails and trying to edit something. So again, right tool for right time. We're also seeing a rise, I'm afraid, in requests for car assessments. A lot of people are now using their cars as workplaces. It's really important that we get the car set up right, and just providing some basic setup will help to mitigate those problems. So do use that. The other thing to say is a car is a personal space. So once again, maybe voice activation is something you could use in your car rather than having the restrictions on your ergonomics and causing awkward hand positions. Home DSE, a lot of people have been doing this for a long time. It's probably going to be an element of your agile working. A lot of times I've found that it's become a large amount of time and it hasn't been noticed. People start off doing the odd bit at home and then they really start to creep to work long periods of time. So we need to make sure that people, again, have the right tools. If they're now working predominantly at home, they need proper workstations. We also need to be aware that our home spaces are often getting a lot smaller, so we're going to be needing to share space with others. So if we are providing equipment, let's provide equipment that is able to be put away or used maybe for the rest of the family. Maybe providing a sit-stand workstation would encourage other members of the family to work well too. So lots of opportunities there. But do consider working at home. Does it really matter whether they are a dedicated home worker or not? If they're spending a significant period of time, they need a decent workstation. So, key body messages. These I tried to make it quite tight and just to try and sort of help us along our way. Don't look down for extended periods. If your muscles are getting tight and sore, you are looking down too much. Maybe ask a colleague to take a picture of you when you work. It'll probably be quite scary. You will be leaning forwards looking at your screen. This is not a good thing. Myself and my colleagues, we are seeing more neck problems than ever before, so please think about that. If you can't feel your back when you're working, you're probably leaning forwards. So take a moment, just think, am I having good back support? Have a look at your wrists and hands. Are they relaxed? Are they tense? Is there a straight line from your elbow to your fingers? If there are angles at your wrists and your fingers, there's probably tension, so maybe think about that from time to time. Make sure your feet are supported and your hips are higher than your knees. That gives you half a chance to have a really good supported back position. And try and move more often than the body asks you to. If you're feeling stiff and tense, you've left it too long. Try and back it down and move a bit more regularly. This is some guidance that's come from Alan Hedge over at Cornell. This is where we're sort of heading about movement, sitting and standing. And the current guidance seems to be that for every 20 minutes you sit, you should be standing for 8 and moving for 2. And if you can do that, you will feel so much better. and you'll achieve the sort of 4 hours plus that we're really trying to achieve with people today to reduce our sedentary workforce. And you will feel so much better for this. So think about it today. What is your breakdown of sitting, standing, moving? It's not standing for long periods. It's getting that movement throughout the day. I get asked these questions quite a lot. How should I advise our staff? How often should they be moving? How long can they use workstations? It's a very difficult thing to say, but I've tried to provide a little bit of guidance here. It will depend on how they work. It will depend on many other items, but I would suggest that if you are seated at a workstation with a good setup, you probably need some sort of movement every 20 minutes and get your bottom off the seat every hour. If you're sitting in a workstation with a good setup and you're sit stand, I couldn't read my own notes there, beg your pardon. If you're working in a sit stand with a good setup, if you're moving from sit to stand every 20 minutes, as I said on the last slide, standing for about 8 to 10 minutes and then going for a quick walk to the printer or glass of water or pop up the stairs, that's probably a really good way to work. If you're now working on a mobile device, laptop, but you're not inputting too much, again, you're probably looking at movement every 20 minutes, bottom of seat every hour. So something similar to a good workstation, but obviously not if you're inputting a lot. If, however, you're using these mobile devices and you're having to input, you probably need to reduce that time so you move about every 10 minutes and get up every 20. And then the worst sort of postural sort of situation is going to be the small device work. Try and swap hands and move your shoulders at least every 5 minutes. I know that seems a lot, but honestly, we really do need to do that with the postures we assume. And then change position every 10 minutes and break about every 20. And if you can get into the habit of when you change your task move, you really will make a big difference to yourselves. So finally, need to just go on to my final slide about how to make agile working work. I think clarity, openness on the practicalities, providing good information that's clear, accessible to everybody. We need to be very pragmatic and task focused. Things are going to continually change and we need to have that dialogue to make sure that as situations arise, we're ready to provide advice for them. Communication must be considered and accessible. We need to train our managers well. We need to provide suitable, flexible environments for different tasks and people. We need to make these areas desirable and flexible. And don't forget the basics. What's good for the body is good for the eyes and it's good for the mind, therefore producing much better work. I hope those tips have been helpful for you, and I shall pass over to Tony.
Thank you. We do actually have 3 questions in, which I'm gonna ask now. Also, if while I'm doing my bit, anybody has any questions for Katharine or any questions for me, we should have some time at the end as well to talk through. Equally, if we didn't have time and you asked the questions, we would actually get back to you. We would respond in writing. So the first one is, could Katharine give a brief summary of what she means by agile working?
Yes, I mean, it's a very difficult, we all use different phrases. I would say agile working is anything where you don't go to the same workstation in the same office every day. So where you are going to be using a number of workstations, I would say that's agile.
Absolutely, and I think I would say the same in terms of my definition. It's definitely someone that could be jumping around different offices, even around the site, doing a bit of work from home, different countries. Yeah, we use that definition in our workplace for agile working. So the second question, I'd be interested in understanding the speaker's thoughts on international workers, both those that are based in country, but also those visiting outside the UK. How does the legislative requirements differ from UK, if at all?
Oh, it's a difficult one. I mean, I'm not I mean, I do some work abroad. I very much focus on the body, though. I suppose I go back to basics and say, if my job is to ensure that people are, I suppose, discomfort free, so they're able to concentrate on their work. So I don't think really it does change that much, because I think the thrust of all our legislation really is to do the same. I think that's probably all I can say, is just focus on the basics.
And I think I would echo that. I suppose we could go down the route of saying the legislation of the host country. If we're sending workers abroad, they should adhere to, I suppose, what we expect from the guys here. But I think we're probably about making people comfortable so that they can work to their optimum level. I suppose that's kind of the most important thing, certainly for me and my business. The third question, we class home workers when we provide workstations, chairs, etc. as working from home 3 days or more a week regularly. Is this reasonable? Others are classed as agile and only IT equipment is provided.
I think that's a very interesting one. It's one I get asked a lot. I'm probably going to sort of disappoint by saying I think it's all about sorting out their DSE health. What are they doing the other days? If they're doing the same sort of work other days, you could develop quite a lot of discomfort if you are working 2 days together in a poor position. So I think we want to try and achieve a decent working position, no matter where you are, no matter what you're classed. But a lot of people do say 2 days or more, and they'll provide a home workstation. It's a good start, but I would then question what is happening the rest of the time.
We've had a few more questions in, so we'll tackle those we can before we move on. So I have experience of a manager insisting that office-based staff have to clear their desks every evening and then sit at a different desk in the same workspace each day to demonstrate agility. That's quite interesting. This does not sit well with me as a DSE assessor, particularly where disability is involved. It does not make it a brilliant place to work. What are your thoughts?
I'm never one for setting strict things down. I quite like the idea of encouraging people to move and learning to adjust their workstation. So part of that, I have a degree of sympathy for the person who suggested. But it really does depend on what that person's disability is. Some disabilities are not do need their own workstations. And if that is the case, then they should absolutely be supported in that. But actually, with the flexibility of some workstations these days, we are able to accommodate a far wider group of people. So some disabilities may well work on agile working situations. But I think blanket rules never really work. You need to be able to be flexible for flexible situations. So I would encourage flexibility, but also it'd be nice to encourage people with disabilities to be able to work like everybody else and not single them out as well.
That's a good. I'm glad you answered that one. I thought that was a very good answer. How would you approach? So, next question: how would you approach DSE assessment for an aging workforce, mainly based in the office, where health conditions exist, mainly musculoskeletal related?
Oh, something very close to my heart, being one of these aging workforce myself. I think this is a great opportunity. I think agile working, creating flexible workstations actually will allow us to accommodate the aging workforce much, much better by allowing people to set up workstations they need, allowing them and encouraging them to move. I think actually supports our aging workforce far better. One of the biggest barriers to our aging workforce being in work is lack of flexibility. And I think agile working actually allows a lot of flexibility. So I'm very positive about the future for agile working and the aging workforce. So yes, flexibility, it will allow us to accommodate a lot more people.
Brilliant, thank you. I am going to move on. I'm conscious of the other part of the session, but as I said, we will answer all questions. So if any others come in, or if I've missed any, we'll either answer them live, or we'll take them offline and give you an answer directly. So the next part is myself, mental health for agile workers. I will add, this is obviously the first webinar that we're doing as part of the Financial Services Group. I don't intend to speak very often, maybe other than to introduce other speakers. We just wanted to give this a go whereby I'm going to share some of the experiences I've had in various different employers, assisting those with mental health, and in general, trying to assist with people's mental health resilience. So rather than give you various statistics, we all know that 70% of statistics are made up on the spot, so I'm not going to bore you with statistics. You can go to the IOSH have documents that give you statistics on everything to do with mental health. There's a specific document on it. Obviously, organisations like the Health and Safety Executive in the UK have their own statistics. Also, speaking of the Health and Safety Executive, they obviously have the management standards. It is not my intention to go into that today. That's not a criticism of the management standards. I think they're very good. What I wanted to do was just do something a bit different, because you've probably heard about all those topics so often. I suppose to come back to the definition of agile working, it's the exact same as the definition that we've already said. It's anybody moving between different sites, traveling a bit, home working a bit, and even bouncing around different desks on one location. And I think you often get people that don't do agile working think it's great that you don't have to commute like they do, that you get to sit at home loads. The reality is, I was actually talking to a home worker yesterday, never mind an agile worker, who, since he was made a home worker 2 years ago, told me that he's only worked at home for 5 days, because the reality of his role is that he works all across the different sites of the organisation in which he's employed. So I suppose one of the first stresses that agile workers get is that they feel like that they need to demonstrate that they're there for work, to other colleagues, to the leader. They miss things like breaks as they try and push the long hours that they work. They might start working when they would have commuted and finish when they would have finished commuted, or even longer. So how do we support them? Now, the first thing I'm going to talk about is time. I'm not talking about the traditional time management training that you get sent on that actually feels a waste of time, or rather ironically. I'm talking about managing your time yourself so that you can set yourself mentally when you start work and when you finish work. Now, there are various tools. I've quoted Outlook as one of the tools to do that. But we give these tools and then we don't train people to use them, and we don't encourage people to use them. So the first thing I'd say is encourage people to use the tools that you give them. They can put, certainly with things like Outlook, with things like Google Calendar, etc., you can mark appointments as private, and you can actually, in reality, put your personal and work things in one place so that you can actually manage your time, so that you manage that agility as you're bouncing around to all the different locations that you may be going across your working environment. I would always say, and I'm not going to cover ergonomics too much because it was covered excellently by Katharine, thank you. But yeah, it is important to have a dedicated space that you work. If you work from anywhere, you will always have a tendency to think, what time is it when I'm going to get interrupted? Whereas if you can set a dedicated workspace to one side, you're not going to have that stress. Also, where you work longer days, can you work shorter days? Can you use your calendar and your role to make sure that you balance? Yes, you might do a lot of traveling, but can you have days where you can catch up on the paperwork? And part of that is you yourself managing it and learning to say no, or if not no, learning to say, I'm sorry, not now. We'll rearrange that. We'll do that at another time. And also, I've got a specific slide on technology, which I will keep mentioning, I suppose. But what technology can you use to actually reduce the amount of travel that you need to do as well as an agile worker? So, as I said, this is very much on the positive. So, as a health and safety professional, we have health to do as well as just safety. And some of the examples that I've done in the various workplaces that I've been have been to encourage people proactively to do things. So, have a lunch break. actually, if you don't have time for a lunch break, make sure you have time for something to eat rather than grazing. And I will come on to food as well. We've already covered ergonomics, but I am somebody that uses a sit-stand desk. I actually really like them. I've got one of the portable ones, so when I'm actually working at home, I can get it out the cupboard, put it on a dining room desk, or actually, to be honest, a desk I do have set aside, and then I can actually sit. And I've actually found I'll sit all day. Oh, sorry, stand even all day, and I don't get that lull in. And Katharine's saying, "Ooh, maybe not." But to be honest, because I don't do it every day, because I am an agile worker and I have to sit on my bum in a car, on a train, or in an office, I actually do find some days standing. Actually, it is just quite nice. It makes a change. But think of your organization. You've probably got an intranet. So can you put information on your intranet to actually encourage people to exercise? It's often easy to do on a physical site. You can get people on bike to work schemes, you can have walking clubs, running clubs and all that. But actually it can be, with a little bit of effort, it can be done for agile and home workers as well. I've given an example here of World Walking. So that's an app and a website where you can use a wearable, or you can log your steps. You put it in, you choose what walk you want to add your steps to, and that does a virtual walk from A to B. So at the moment, in my employer, we're actually, as a company, we've decided that we're going to walk across the world. We've started, it's a walk that's already done, and all of our people in either teams or individuals, for those that are agile workers, adding up those steps, and we're getting, we're feeling inclusive, because actually we're all contributing to these steps. And also there's a bit of competition through motivation. So who's put the most steps in today? You get quite a bit of banter, both virtually and, you know, amongst teams. And it's just a really, I mean, it's one example of many. But it's a really good way of actually appealing to those that you're not just having in an office. Also, we've promoted all the freely available resources, the likes of the NHS, and down the right there with related apps and related links, just some examples of all the free things you can plug into, so you can encourage people to use freely available apps to get themselves fit, even though they're not necessarily in the office. Now, to do that, you need the right forums, and potentially you need the right technology, and I will come on to that in our technology slide. Eating out. So as an agile worker, you're either at home and you'll graze because you don't want to get away from your computer and your phone for too long, or you'll be stuck in an airport or in King's Cross, in my case the other day, and you'll kind of look around and there'll be something nice and deep fried and covered in something or other that you don't want to. Actually, King's Cross is probably a bad example, because there are some really nice places to eat in King's Cross. But yeah, out and about, it can often be difficult to choose the healthy option. So how can you encourage your employees to do that? We actually did a guidance document that we give to people on induction that talks through all of these, but also then we do promote them on an ongoing basis to encourage people, both in the office. Once again, in the office it's easy, all the fruit drops and all the things that you can do there, but also for our home workers and agile workers, we have a specific agile working and home working forum where we can push this information out. We have an intranet that we can push this information out. And also when we set these, when we set challenges from a well-being perspective, we make sure that we include them. So another example, we did a promotion whereby we went up to all agile workers. On the right hand side there, you can see the healthy eating recipes. We deliberately picked all the major supermarkets and linked to their healthy eating web pages, and we challenged all of our home workers and agile workers to pick something in advance and eat something healthily for that day. You know, don't just graze on that day. Make sure that you prepare yourself something that's a nice healthy meal, because if you can get them doing it once, or some of them doing it once, maybe you can get them doing it to do it again. If you don't get them to do it this time, next year or in 6 months time, or whenever you've set yourself a calendar of promotion, maybe you can get more doing it next time. And also when they're out, can you encourage them to look around and go, no, don't walk into that sandwich shop and have something covered in mayonnaise. Actually walk in a little further and go into a shop and have something that's actually healthy. Because once again, if you can do it once, or some of them doing it once, they will think about that themselves. it is about ongoing promotion. It's one of those things that's almost a thankless task of constantly trying to get people interested. But the more you do it, the more people get interested themselves. And then actually some of the technology and some of the forums that you can put into place, if you can get them talking about it amongst themselves, then actually it can become self-perpetuating in some way as well. And that's what I mean there when I'm saying that it's promoted through an Agile Workers Forum. We also did something with Stop the Coffee and Stop the Fizzy Drinks, and we actually linked that to charity. So we said, just drink water for this day, and all that money that you would have spent on the overpriced coffee from various coffee chains, or the fizzy drinks that are potentially overpriced, actually contribute that to charity. And actually you get a good sense of well-being from the fact that you've made a charity donation, as well as a sense of well-being of actually, for one day I've just drank water. And once again, that's the kind of promotion that you can promote on and on. So yes, I've started with exercising and eating, and the reason I've started with exercising and eating is physical resilience leads to good mental health resilience. So if you can encourage this, you can potentially get some really good benefits of increasing people's general resilience to the stresses that life and that work throws at them. Technology. We all criticize technology. I'm actually going to say this technology is working really well. Thank you, Ben, for coming in and helping us. We always say that we should turn off more, and I do agree with that. I actually turn my I'm a kind of guy that doesn't actually sleep much. I sleep about 5 hours a day, but because of that, I turn my mobile phones off when I go to bed, because I know I need that sleep. And we should encourage people to turn off, because if it's on, it'll be in your hand. You have that temptation to answer that work email, to make that one last call, especially if it's the boss. You'll pick it up and you'll do it. So if you can turn it off, you won't. So yes, I understand that, and I do accept that that has a big part to play, and we should encourage that kind of thing. But think about the kind of technology that you have. I've got various logos here, some of which is free, of the kind of technology that you can potentially use to actually increase the connectivity of Agile workers. So Agile workers are luckier than home workers in lots of ways, because yes, they are going onto site, so they do get some of that physical interaction. They might get what I call those water cooler conversations. You do get the opportunity to feel connected with the team. But also there is a certain amount of isolation that goes with it, because you don't see your team as often. Maybe you only see them once a month. Maybe you talk to them more on the phone. So can you get yourself an Agile working community using things like discussion forums? You might have your own on an intranet. You might use something like Yammer, that is basically like a works-based Facebook, or sort of a closed LinkedIn, if you're more familiar with those pieces of technology. Can you encourage people to video conference rather than phone, so that actually, you're looking in the whites of somebody's eyes, you're seeing the way that their face moves. You can tell by looking at them that they're actually paying attention to what you're saying. So think about your technology and think about actually how can it empower how connected my people feel, because the more connected they feel, the more connected they feel to their organizations, the more social they feel, the more social interaction they get from work, and once again, the more resilience they'll feel overall. And as I've said there in the slides, it's about creating social opportunities, because people in the office get them. So you have to spend a bit more effort trying to give that to your home workers and your Agile workers as well. We also do, using my own workplace as an example, we actually also have an Agile Workers Forum where it's a mixture of face-to-face and also a dial-in come virtual meeting. So it's an opportunity for them to talk about different things, for then to go to somebody that's suitably senior that can then help to action what might be, it might be a difficulty with technology, or various other things. And we also have a community on Yammer where people are talking about the common things, and it gives them the opportunity to post things that are interested to them, that might be things like how to boost your mental resilience or how to exercise more, that they then get conversations, so that they are generating their own social opportunities through that technology. Leadership is essential. I'll use the term leader rather than manager, but whatever you use. A person's perception of their employer, a person's perception of what their employer expects from them, it derives itself from their perception of their leader, for the most part. So with leaders, the first thing I'll say is, have they ever managed an Agile worker before? Because actually managing an Agile worker is slightly different to managing a team that are all sitting in one place. So can your organization develop information? I could do the health and safety bit because I haven't done much yet and go information, instruction and training. Can we give that to our leaders so that they understand the nuances of managing an Agile worker? Are we going to, when we induct our new Agile worker, is part of that induction going to be helping to induct the leader into the differences of that? So a leader needs to set clear goals when it comes to an Agile worker so that they don't get those feelings of isolation, so that they do understand how their role contributes to the organization and to the team. I suppose, using myself as an example again, I think thankfully my leader isn't on this call, so I can compliment her without her knowing. I would hate for her to know that I actually respect and like her, of course. So where my leader does very, very well is we have a weekly Monday call that's about an hour long, and it's our entire team, and we talk about the things that we have on, problems that we might have, shout outs for help. We have an hour on the phone together as a team, so you're feeling like a team. You can understand in what everybody does, where you fit in that jigsaw. Now, on a Friday every week, I have a phone call that's about half an hour long, and it's more about myself and how am I coping with work-life balance? What are my main challenges, etc. How can she support me? And then every month, I have a one-to-one, which is an hour long, that goes through how the month went, how I'm future planning. And I'll be honest, that makes me feel connected to a team. So that team, physical team, is largely based in Liverpool, and I live in the northeast of England. But I actually feel as much a part of that team. I can have the kind of the level of banter that they have, and I can join in that, because once a week we get on a call. We talk outside of that. I'm talking obviously minimums, not maximums, but I feel part of that team because of the way that I'm included within it. And I'll be honest, I've copied that behavior with the people that work for me and got feedback from them. They're Agile workers and they feel connected, even though we're not always in the same place. I mean, those monthly one-to-ones are sometimes physical and sometimes not, but it doesn't matter, because I do understand how my role is contributing to the organization, because we've got good appraisals, we've got clear goals, and also I've been communicated with effectively. Obviously, it's important to adapt communication styles to the individual. So you will have certain individuals that don't do well on the phone, which makes it difficult with Agile workers. So I would always say it's good to talk to them, but if you're going to give them things to do, it's probably as important to actually back that up with an email of all the things that they need to do, because if that's their communication style, you need to adapt your communication style a bit as well. Within my organization as well, we do have something that we designed ourselves called a wellness action plan. So if you're returning to work and you've had any period of time off through mental health, this wellness action plan helps to guide a leader individual conversation with the kind of things that we need to talk about specifically in relation to mental health and how we can best aid you in returning to work. I don't particularly want to dwell on absence, because as I said at the outset, this is actually about all the bits you can do to increase somebody's mental health resilience, and I wanted to just take a different approach to it, because you've heard all the other things before, or possibly have. I will say with absence, it's essentially, yes, you might need to use someone like occupational health, because it may be a complex anxiety, depression, bipolar, schizophrenia, self-harm, all those very complicated mental health problems. It may be that you need their input. However, I would always say the main thing is a leader individual conversation. So the leader may need support from human resources, from experts, in being able to have that one-to-one conversation. It's about being honest about what they can do and what you can do to get them back to work. And I've put here, it is about creating conversations. And I have to say, I think health and safety professionals do this very well. And I think we do it well because we're used to doing accident investigations. So we're used to asking the question in several different ways to get back to what actually happened. But I do see leaders doing this very, very poorly in general without the right support. And I don't intend to go through all these questions. I'm sure you're reading them as I'm talking. So it's about making sure that leaders ask the right questions in the right way, in the right tone, so that you get the right answers, so that you can make the correct progress positively. So as I said, I'm not going to dwell on absence. Personal security, I thought it would be remiss of me not to include this, albeit very briefly, and it has a mental health relevance in that if people feel unsafe, it may impact on their mental health. You can do this very differently from organisation to organisation. You can have very fancy systems that you have in place where you book travel through and you book your hotels through a system that it then pings and tells you where it is, and it drops into your calendar and it drops into your leader's calendar so they know where you are. But actually, if you don't have things like that, it does come back to actually, does your leader know where you are? It's good for them to know that, because when things happen, they can make sure that you're okay. Comes down to simple processes. Certainly with my team, we have a shared calendar where we drop everything in terms of where they are, so they know where I am, I know where they are. If something happens, be it a weather incident or a security incident, I can call them, or I know why they're calling them if they call me. I have referenced, so there are some excellent videos on YouTube if you can embed them into to security presentations. Eyes Wide Open and Stay Safe Firearms and Weapons Attack are really good videos to use in any kind of training or information. Also, I think one of the most under-recognised things is you can join up to the emergency SMS, so you can text that you've got an issue to 999. You have to pre-register for that. So that's something, you can Google and get all the information about that. So I mention that because certainly with the world circumstances at the minute, I think it would be remiss of me to not mention the fact that personal security also impacts on mental health, and the right processes can give your employees the confidence that they can travel and travel as safely as possible. So to summarise then, I think if we're looking about trying to increase mental health resilience, trying to make sure that people have good mental health resilience, it's about informing them of what they can do and what the employer can do for them. It's about empowering them to make decisions for themselves. And it's about creating conversations so that they feel engaged, so that they feel part of a team. And as that nice picture of technology has shown there, sometimes it's using technology to do that, or it's thinking smartly, how can I do that? Now, one thing before I move on to the questions, I don't think we often cross-promote, but IOSH has actually sponsored some research on distributed workers, which has been led by Norwich Business School in association with Affinity Health at Work. On the 6th of July, I think I'm right in saying this, on the 6th of July, this is getting published. A friend of mine actually showed me the link, which I have on the slide here. I was actually really impressed with the speakers personally. If you're around in Surrey on the 6th of July, it's certainly, take a look at the link. To me, it certainly looks like they have some excellent speakers, and I'll certainly be interested in seeing what the research on distributed workers has to say as well. So that's it from me. I think we have some questions. Yes.
Yes, that's correct. Yeah, we've got some questions. What I'm going to do is just to give Tony and Katharine a couple of moments to have a little look through what they've got. I'm going to launch some polls, just if you wouldn't mind taking a few moments just to answer the 4 simple questions that are going to appear on your screen now, just so that you can get an idea. So we can get an idea of how you feel that the webinar had actually gone. So if you wouldn't mind taking a moment to have just to answer those, that would be fantastic, and then we'll go through the Q&A.
Tony, we've got a question come in. I think it's very much appropriate for you to ask this. So it says, do you think it's appropriate to maybe provide refillable water bottles to encourage people, not to spend money on expensive drinks and whatever, and to drink more water? Do you think we should be doing that?
On a personal basis, yes, I quite like it. Certainly, I've worked for various employers that have water fountains or have an ability to fill your own water bottle from somewhere. I don't drink tea or coffee, so I drink a lot of water. So I'm insanely biased. But yeah, personally, I do think that's a good idea.
Okay. I think this is one really probably that both of us could answer, but I'll let you have a first stab at it. We've got how would we support an agile worker who's no regular office at all, but spends their time working extensively on their computer, in order to visiting different places, particularly worldwide. I mean, certainly I've got my views about ergonomics, but actually I think it crosses over very much into some of the other areas you've been talking about.
And yeah, very good question. I think this does come down to communication. I think it's very important that that person has good communication with their leader, so that they can understand that what they're doing contributes. I think if it's possible as an employer, can you give them social opportunities? Certainly with auditors, they do get some of the human interaction when they get to go on that site. I've done auditing myself. You do get some of that, but obviously it's not from your employer. So you want to make your employee feel engaged with yourself. So yeah, I would say absolutely essential that they have communication, maybe along the lines of, I mean, I just gave an example with myself and my leader. I think that works very well. It's not the only way to do it, of course. You can do it in various different ways. But yeah, it comes down to communication. If possible, can you use forums? Like as I mentioned, we use Yammer very much, and it's colleagues from all different business areas that sign up to this Agile Workers Forum of their own volition. And we also have a health and well-being one that's very popular, and people go on it and they talk about things that are interesting to them, to colleagues that they may never meet physically, but actually they end up in almost social relationships with, through the use of technology.
I don't know whether, I mean, my views, I mean, on this would be, if somebody's, auditing, going to different offices, again, I think it comes back to asking in advance to make sure they have a suitable workstation, so that when they're on site, they've got a decent workstation. But I would strongly encourage looking at what are they doing when they are traveling. Have we given them the best technology to do it? Are they able to use voice activation to write their reports rather not? Or maybe is there a different template you could give them? So I think as we need to keep an eye on the tools we give people to use on the move to make sure the ergonomics is good too.
I think we've got some DSE questions to ask now. I can Katharine's been smiling at me when she got the chance to ask questions, so I can smile back at her now. If we start with the last question that related back to one of the other ones, which was explaining, it was the other 2 days in the office. So that was the question about 3 days spent working from home. So the other 2 days would be in an office with proper workstation set up.
I mean, that would sound appropriate to me if they've got a good workstation at home for 3 days, and then they're going to an office with 2 days with a good workstation. That would seem entirely appropriate to me. But what I would say is that we do need to make sure people know that they should sit, stand, and move, even if they're good workstations. And I think all too often in office environments and at home environments, we're not seeing that. We really need to encourage people to do that.
I think I'm going to take one more question just because of the time, and we will. Anybody else that's asked a question, we will get back to you directly. So, how would you support in terms of agile working? Sorry, an employee who has no regular office at all but travels all the time and works extensively on his computer. Oh, sorry, no, that question we've asked already answered. Right, here's a question. Many of our staff stay at their workstations during lunch breaks. What are your thoughts on that? I know my thoughts on that are that it's always good to get away from your workstation. I see various people just flicking through the news, so they are taking a break potentially. But personally, it's good to get out, have a walk, and I've even seen some employers remove canteens or remove vending machines as a way of encouraging people to actually get out, go and buy some food and go for a walk. So what are your opinions on that?
I think one has to almost ask, why are they sitting there? I think that for me, there's two issues. One is, there should be somewhere on your site that's an encouraging area to go and want to go to. So I would say people need to look at the areas and make sure there are good areas that people want to go for breaks. The other thing would say, I think it's actually a very, often a sign that people aren't organising their work appropriately. People should be taking a break during their lunch hour. And if they say, oh, I haven't got time, then we need to actually challenge that, because I think it's often a sign of overload as well. But yeah, ideally, I suppose if I was into rules and regulations, I'd be going, no eating at your desks. But I know that's not always possible.
And the last question before we wrap it up. Someone has an overseas colleague who, it had been noted by colleagues in her office, worked with her legs folded up underneath her and crunched over her computer. She claimed it was cultural to sit this way and didn't want to any offer to separate the keyboard, mouse and screen. They liked the way they were working. So how might you start to address this situation sensitively?
Gosh, that is a difficult one. I think the only thing to do is to explain the reasons why we don't like it. You know, the fact that it does impair circulation, it does put the joints under pressure, and that we are concerned about their health longer term. I think it's important, though, to use light touch, because they obviously haven't recognised this as a problem. And what you don't want to do is create a barrier, because we'd like to think that maybe in 6 months' time, when they've thought about it, they're prepared to come and talk to you again. So we can't force people to do things, but I think it's our duty to point out the problems and to ensure dialogue remains open.
One more question that I keep saying one more question. We've just had one more in. How important do you believe it is for employers providing meditation as part of a good mental health program? Right, I will take that one. I will ask Katharine's opinion as well. I've seen some really good things on mindfulness and meditation. There are some really good things online on things like YouTube that you can place on intranets. I've seen some really good apps that people can use on the phone to increase mindfulness, and I've certainly been in talks and listened to seminars by some very good people on mindfulness. It's one of those, I'm deliberately saying mindfulness and not meditation, because I think when you say meditation, to some people they have a different perception of mindfulness, although even then I think our perception is a little behind what it should be. I'll be honest enough to say, when I first heard about it, I immediately said that's not really my thing, and then I gave it a go. And actually, I've got a meditation app that I use on my phone that actually helps me to try and get to sleep. And I do think it's really good if you can promote it through various different bits of well-being. That is one of those things that I've promoted it through an intranet, I've promoted it through apps, and then following on from that through ad hoc seminars in different locations, just building up giving them an introduction to it and then building their familiarity. And where that's happened, I've seen it work really well. But I'll ask Katharine her opinion on that. I'm not sure if you've experienced it. Yes,
and actually I think really quite boring, because I think I would say exactly the same as yourself. I think it's a very useful tool. It has certainly helped me, although I tend to dip in and dip out, and I suddenly realised that perhaps I've not been using my techniques and I've let things get on top of me, and it helps me to refocus, and it certainly helps me to prioritise my work. So I think it actually has some business benefits as well as personal ones. So yes, I think it's definitely something that should be part of the toolkit.
Brilliant. Well, that's it from us. I will say, on behalf of the group, thank you to Katharine for coming along and doing that presentation. Thank you. And I will hand over back to Ben. And thank you all for listening as well.
Yeah, brilliant. Yes, definitely. Thank you very much, Tony and Katharine. I don't know about you, but I definitely found that very informative. Thank you very much for everyone for signing in and attending today, and thank you for your comments with regards to the polls. It was mentioned earlier, this session has been recorded, and copies of the slide will also be made available. So I will be emailing you all separately, either later on this afternoon or early next week with the details. We will also put the recording on the group's microsite as well, so that you can access it through there. We have managed to get through all the questions, which is great. So all that's really left for me to say is thank you very much for attending, and I hope to see you at the next one. Thank you very much.